Before you put any eardrop into your ear, there is one question you need to answer first. What is actually causing the problem? Is it a bacterial infection, earwax, inflammation, or could your eardrum be damaged? Because 5 commonly used ear medicines, Ciprofloxacin, Ofloxacin, Neomycin, Acetic Acid, and Carbamide Peroxide, do completely different jobs. One may treat a bacterial infection, another may help with an external ear infection, and another is designed simply to soften earwax. Choosing the wrong product can mean more than just wasting money. In certain situations, it can cause irritation, allergic reactions, or other complications. So in this video, we're going to break down these 5 ear medicines, what they actually do, their important risks, and the situations where you should not use them without medical advice. Let's start with ciprofloxacin eardrops. Ciprofloxacin is a fluoroquinolone antibiotic. Its purpose is to treat certain bacterial infections of the ear. This is important because an earache does not automatically mean you have a bacterial infection. Ear pain can have many causes, including infection, inflammation, wax buildup, pressure problems, or injury. An antibiotic only makes sense when the underlying problem is one that the antibiotic can actually treat. Ciprofloxacin works by interfering with bacterial enzymes needed for bacterial DNA replication. In simple terms, it prevents susceptible bacteria from properly reproducing and surviving. This makes it very different from an earwax removal medicine such as carbamide peroxide. One important reason fluoroquinolone eardrops are frequently used in certain ear conditions is their role in situations involving a non-intact eardrum, depending on the specific product and diagnosis. But this does not mean you should diagnose yourself and start ciprofloxacin whenever you have ear drainage or pain. A healthcare professional still needs to determine what is happening inside the ear. And here's an important point. Antibiotic eardrops are not automatically better than non-antibiotic drops. If the condition isn't caused by bacteria, an antibiotic may provide little or no benefit while exposing you to unnecessary medication. Ciprofloxacin can also cause local side effects such as irritation or discomfort. If symptoms become significantly worse, if you develop severe pain, swelling, fever, worsening drainage, or hearing changes, you should be evaluated rather than simply increasing the number of drops. Now let's move to ofloxacin eardrops. Ofloxacin is another fluoroquinolone antibiotic. Like ciprofloxacin, it is used for certain bacterial infections of the ear. The important thing to understand is that ofloxacin and ciprofloxacin are different medications, even though they belong to the same antibiotic family. Ofloxacin has specific otic formulations used for certain external and middle ear infections. Depending on the product, it can also be used in situations involving tympanostomy tubes or a perforated eardrum. That makes it particularly important for patients whose ear anatomy isn't completely normal. But don't make the mistake of thinking, my eardrum might have a hole, so I'll just use ofloxacin. The correct medicine still depends on the diagnosis. Ear drainage can have several causes, and persistent drainage needs proper evaluation. Another important issue is antibiotic resistance. When antibiotics are used unnecessarily or incorrectly, bacteria can become harder to treat. That's one reason you shouldn't use leftover ofloxacin from a previous ear infection for a new episode without professional advice. So if ciprofloxacin and ofloxacin are both antibiotics, why might a doctor choose one over the other? The answer depends on the specific clinical situation, the formulation, the suspected organisms, previous treatment, allergies, and the patient's overall history. There is no universal rule that one is simply the strongest. Now we need to talk about Neomycin, because this medicine has some particularly important safety considerations. Neomycin is an aminoglycoside antibiotic found in several combination ear products, sometimes together with polymyxin B and hydrocortisone. These products can be used for certain superficial bacterial infections of the external ear canal. But neomycin comes with a warning that deserves your attention. Neomycin can cause allergic skin reactions. The EFTA labeling for cortisporin solution states that neomycin can cause sensitization, with reactions potentially including redness, swelling, scaling, and itching. If sensitization or significant irritation develops, the product should be discontinued. This creates an important situation. Imagine someone has an outer ear infection. They begin using a neomycin-containing eardrop. A few days later, the ear becomes extremely itchy and irritated. They may assume the infection is getting worse and continue using the drops. But in some patients, the medication itself can contribute to the reaction. That's why worsening itching, redness, swelling, or irritation while using a neomycin-containing ear product should not simply be ignored. But there is an even more important concern: ototoxicity. The FDA labeling for cortisporin solution warns that neomycin can cause permanent sensorineural hearing loss due to cochlear damage, with the risk increasing with prolonged use. The label also states that the product should not be used when the tympanic membrane is perforated. This does not mean every person using a neomycin eardrop will lose hearing. It means the medication has a recognized potential risk under certain circumstances, which is why the product has specific warnings. This is one reason you should never assume that every eardrop is interchangeable. If you've ever been told that you have a perforated eardrum, ear tubes, or previous ear surgery, make sure your healthcare professional knows before you use an ear medication. Now let's move to acetic acid eardrops. This one works very differently from the antibiotics we've just discussed. Acetic acid solution is used for certain superficial infections of the external auditory canal. The formulation is acidic, and the medication has antibacterial and antifungal activity. In other words, acetic acid isn't simply another antibiotic like ciprofloxacin or ofloxacin. It changes the environment of the ear canal and can help treat certain external ear conditions. This can be particularly relevant in conditions affecting the ear canal, including some cases of otitis externa. But there is a major precaution. The U.S. labeling states that a perforated tympanic membrane is considered a contraindication for acetic acid solution. So if you have a known or suspected hole in your eardrum, don't assume an acidic eardrop is safe simply because it is sold as an ear medication. Acetic acid can also cause temporary stinging or burning, especially when it is first applied to an acutely inflamed ear. The labeling also advises discontinuing the product if sensitization or irritation occurs. This is another reason why the diagnosis matters. If your ear canal is inflamed, an acidic solution may produce some discomfort initially, but significant or persistent worsening should not simply be ignored. Now let's get to the fifth medicine, and this one is completely different: Carbamide Peroxide. If you've ever bought an over-the-counter earwax removal product in the United States, there is a good chance you've seen carbamide peroxide listed as the active ingredient. Unlike ciprofloxacin, ofloxacin, or neomycin, carbamide peroxide is not an antibiotic. Its purpose is to help soften, loosen, and remove excessive earwax. U.S. OTC labeling lists carbamide peroxide 6.5% as an earwax removal aid. This is where many people make a mistake. They feel that their ear is blocked and immediately assume, I have wax. But a blocked ear doesn't always mean earwax. Hearing changes can have many causes. There can be fluid behind the eardrum, infection, inflammation, pressure-related problems, or other conditions. And if hearing suddenly drops, especially in one ear, that should not automatically be treated as wax. There is another major warning on carbamide peroxide products. The U.S. labeling advises asking a doctor before use if you have ear drainage, discharge, ear pain, irritation or rash, dizziness, an injury or perforation of the eardrum, or recent ear surgery. The labeling also says to stop and ask a doctor if you need the product for more than 4 days or if excessive earwax remains after treatment. So if you have severe ear pain or drainage, don't simply assume you need an earwax removal product. And please remember this, earwax is not automatically bad. Earwax has protective functions. It helps trap debris and contributes to the normal protection of the ear canal. Problems occur when wax becomes excessive or impacted and begins affecting hearing or causing symptoms. Another common mistake is using cotton swabs deep inside the ear. You may think you're cleaning the ear, but you can push wax deeper into the canal. You can also injure the delicate skin of the ear canal, or, if inserted too far, damage the eardrum. Now let's compare all 5 medicines. Ciprofloxacin is an antibiotic for certain bacterial ear infections. Ofloxacin is another fluoroquinolone antibiotic used for specific bacterial ear infections and has formulations used in certain patients with tubes or perforated eardrums. Neomycin is an aminoglycoside antibiotic found in some combination ear products, but it has important allergy and ototoxicity warnings. Acetic acid is an acidic otic treatment used for certain superficial infections of the external ear canal, but products are contraindicated with a perforated tympanic membrane. And carbamide peroxide is an earwax removal aid, not an antibiotic. So which one is best? There is no single best eardrop. The best medication depends on the problem you're actually treating. If you have a bacterial infection, an appropriate antibiotic may be needed. If the problem is an external ear canal condition, a different treatment may be appropriate. If the problem is simply excessive earwax, an earwax softening product may be considered. And if your eardrum is perforated, that single piece of information can completely change which medications are appropriate. This is why self-treating ear problems can be risky. Let's talk about some warning signs that should make you stop experimenting with eardrops and get medical attention. If you have sudden hearing loss, severe ear pain, significant drainage or bleeding, severe dizziness, swelling around the ear, fever, or symptoms that are rapidly worsening, you should seek professional evaluation. And if you already know you have a perforated eardrum, ear tubes, or recent ear surgery, tell your healthcare professional before using an ear medication. Another important point is children. Children can develop ear infections frequently, but parents shouldn't automatically use an adult's leftover eardrops. The diagnosis, product, dosing, and age restrictions can vary. For example, the current Carbamide Peroxide labeling advises consultation with a doctor for children under 12. So don't assume an over-the-counter product is automatically appropriate for every child. Now let's talk about how to use eardrops safely. First, wash your hands. Check the bottle and make sure it is the correct medicine and that it hasn't expired. Don't allow the dropper tip to touch your ear, fingers, or another surface. Contamination can introduce microorganisms into the bottle. Use the number of drops prescribed or stated on the product label. More is not automatically better. And don't share eardrop bottles with someone else. If you have been prescribed more than one medication, follow the schedule provided by your doctor or pharmacist rather than improvising. One more thing. Don't use leftover antibiotics from an old ear infection for a new problem. Even if the symptoms seem identical, the underlying cause may be different. And if you're allergic to a medication, make sure that information is known before treatment begins. For neomycin in particular, a previous reaction involving itching, redness, swelling, or rash is important information because sensitization can occur. Now, here's the biggest takeaway from this entire video. Eardrops are not interchangeable. A bottle labeled eardrops doesn't tell you what is happening inside your ear. Ciprofloxacin and Ofloxacin are antibiotics. Neomycin is an antibiotic with important safety warnings. Acetic acid is used for certain external ear canal infections. Carbamide peroxide is designed to soften and loosen earwax. They work differently, and their precautions are different. So before putting anything into your ear, ask yourself 3 questions. What problem am I treating? Is my eardrum intact? And is this medication actually appropriate for my situation? If you don't know the answers, that's a good reason to speak with a healthcare professional rather than experimenting. Because when it comes to your ears, the wrong drop can be more than just the wrong treatment. If this video helped you understand Ciprofloxacin, Ofloxacin, Neomycin, Acetic Acid, and Carbamide Peroxide, subscribe to Behind Medicine for more research-based explanations of common medicines and their safety. And remember, before you put anything in your ear, make sure you know what you're actually treating. This video is for education only and does not replace diagnosis or treatment from a qualified healthcare professional.